Hi everyone, I'm Dr. Sandeep Sharma. For Super Speciality Pediatric exam, let us quickly revise some salient points related to congenital parvovirus B19. So what are the features that should arise the suspicion of congenital parvovirus B19 in the fetus or in the child? First of all, these children will have hydrops fetalis. It is a non-immune hydrops which is seen. The reason for hydrops fetalis is profound anemia. The virus has a tendency to affect the primitive RBC precursors, and so it produces severe anemia, which can manifest as congestive cardiac failure as well as can produce hydrops fetalis in the child. Secondly, these children can have direct involvement of the myocardium producing myocarditis. Thirdly, they can have hepatitis. And fourthly, thrombocytopenia can also be seen. You can confirm the diagnosis by doing fetal ultrasound and Doppler for middle cerebral artery peak systolic flow velocity, and viral DNA detection can also be performed. Treatment is in the form of fetal transfusions, which can be given.